Interventions with a King. Discussion and commentary based on articles from JACC, Cardiovascular Interventions.
I'm Spencer King, editor of JACC Intervention, and I'm visited today by Dr. David Cohen from the Mid-America Heart Institute. Welcome, David.
Thank you, Spencer.
David has, as everybody knows, done a lot of work with quality of life, cost effectiveness, and everything. And in coronary work, we're very interested in your article that had to do with the SAPPHIRE Trial, which has to do with carotid intervention versus surgery. The SAPPHIRE Trial itself was a non-inferiority trial that showed that stenting was non-inferior to surgery in that observation. The choice between the two procedures, say they do, with more trials, turn out to be comparable. And the question will come: do you do an intervention or do you do surgery? With the coronary, it was a big deal because you have sternotomy versus a small hole in your leg or your arm. Here, it's less dramatic, perhaps. You have a carotid endarterectomy. It's not that invasive. But you've taken a very important look at quality of life between these two procedures. What did you find from SAPPHIRE in that quality of life analysis?
Well, thanks, Spencer, for the opportunity to be here and to present our results. As you described, the SAPPHIRE trial was a randomized comparison in high-risk patients for complications of surgery who were randomized to carotid stenting versus carotid endarterectomy. And at the time of the trial, and still today, we really didn't know anything about the quality of life differences. So this is really the first study that has looked at quality of life prospectively in a randomized comparison. We looked at a number of different measures because there's no single way to measure quality of life. Primarily what we looked at is something called the SF-36, which is a well-accepted, validated measure of both physical as well as mental health. It has several different domains that we'll talk about in a second. And then very specifically for this study, we said that we need some more sensitive measures. We need to develop some very specific measures. And so we developed 6 very specific, what we call Likert type scales, which is named after Dr. Likert, which assessed a number of performance characteristics we thought might differ.
Having to do with what might be, what a carotid incision might affect, is that right?
Exactly. So the specific things we asked about were pain, neck pain, headaches, leg pain, and then we also asked about difficulty with certain activities, difficulty eating, swallowing, sure. Difficulty driving, difficulty with walking. So we had some, and then the time points, because we wanted to, again, be very, very careful to make these measurements, we measured them at baseline, very early, 2 weeks after the procedure, 1 month after the procedure, 6 months, and 12 months after the procedure. So a very, very detailed look at quality of life.
So I guess the day after the procedure, your neck hurts more if you had surgery than if you had stenting.
I expect so. We didn't measure it, so I can't be...
But after a while, how did this turn out?
So what we found, again, obviously randomized trial, patients were well matched at baseline. The main finding of the study was there was definitely a benefit, a quality of life benefit with stenting versus surgery. And it was manifest in several different ways. Role physical function, which basically is the ability of the patient to do their activities that they find important to themselves, whatever their job is or their activities around the house or the home. And then some very specific physical limitations, again, on those specific scales. So we found that patients treated with stenting had less neck pain, they had less difficulty eating and swallowing, and they had less difficulty driving, but at 2 weeks only.
Yeah, I was going to ask, how long did this last?
Yeah, so we found it at 2 weeks very clearly for those 4 different scales, not for the other scales. By 1 month, though, everybody was kind of back to baseline. And at 6 and at 12 months, again, everybody was back to baseline. So I think the message here for me is there clearly is a benefit, a quicker recovery with carotid stenting, but it's not a dramatic benefit. It's a modest benefit. And I think this information will be helpful to practitioners who are trying to inform their patients, and certainly to patients in deciding which procedure they might want to have.
Final thing I'm going to ask you is, given that, what's the main decider for carotid endarterectomy versus stenting? Is this going to be the thing that...
I think the main decider is clearly going to be clinical effectiveness. Because given how modest and relatively brief the quality of life differences are, clinical effectiveness it has to dominate the decision. Once clinical effectiveness and comparability is assured, and we're getting some more information about that from other trials, then we are starting, then I think these secondary considerations of quality of life become more important.
Terrific, terrific. Thanks, David, for visiting with us on JACC Intervention.
My pleasure. Thanks for having me, Spencer.